Thanks for tuning in to the LaMarr Memphis show with Betty LaMarr. LaMarr Memphis features top doctors, community leaders, and people just like you in the Bluff City doing what you do to uplift the city of Memphis. And now, your intriguing host, Betty LaMarr.
We're starting a series about obesity and the health risk of being obese. The good thing about this show is not about being critical. It's about you're learning what you need to know and what you can do. And joining me is Dr. Robert Wegner, and he's one of the masters. And he's coming to us from St. Francis Weight Loss Center. Good evening, Dr. Wegner. How are you?
Hey, Betty. Thanks for having me.
Well, you come highly recommended.
Thank you.
I'm told that you are one of the masters, so I expect for the show to be really, as they say, off the chain this evening.
Yeah, I really want to try to give your viewers some factual information about obesity, why it's such a problem for our society right now, how we treat it, and how we got here, and how we talk about obesity in real, not necessarily medical terms, but in a layman's way that people understand it.
Okay. Well, speaking of that, why don't you tell our viewers who you are, Dr. Robert Wegner, as it relates to our topic of discussion this evening?
Okay. So my name is Robert Wegner, practice bariatric surgery at St. Francis Hospital here in Memphis. Been in the area for about 5 years. I only do weight loss surgery. That's my specialty. I think it's an interesting story, one worth telling, as to how I got on the Betty LaMarr show tonight. Betty and I met several months back socially at the FedEx Family House Gala fundraiser. I feel like there was some divine intervention or reason that our paths crossed. We happened to be at the same table. We just started having a casual conversation. We asked each other what we did and this and that. She said, I do this series on, medical issues, and, I have a public access channel that I work with here in the community, and I'm like, I do a surgery that potentially could benefit thousands of your viewers. She said, well, why don't you come on and we'll talk about what you do. And there's a lot of misinformation about obesity, and maybe you can clear up a lot of the myths and the things that people hear. And, everybody seems to be on a diet these days, and, how come diets don't work? And you want to come on and talk about that? And I said, that would be fantastic. So, here we are tonight, and I just want to thank Betty for having me on, and it's a real honor to be here.
Well, I'm honored to have you. Well, we may as well, class, as I always say, Dr. Wagner, class is now in session.
All right.
Okay. And
live TV. Here
that's
we go.
Right. And you're one of the masters. So let's talk about obesity. What is obesity? And what is BMI, and how do you match that with obesity to determine if you're obese or not?
So to start out talking about obesity in general, to talk about it intelligently, we need to get away from the habit of casting blame on the obese patient and faulting them for having this disease process of obesity and saying, why can't you just exercise more and eat less? And why are you so obese? We have to get away from faulting them like there's something wrong with them. That we have to understand that it takes more than just willpower and more exercise and less eating to really make a substantial change in your body mass index, which I'll talk about in a minute. It's clearly a hormonal and metabolic disease. It's just recently in the past few years that obesity, is actually classified as a disease. There's 3 things that all diseases have in common. Number 1, they cause harm or morbidity to the body. Number 2, they impair normal functioning. And number 3, they have characteristic signs and symptoms that are uniform throughout the disease. So since obesity meets all 3 of those criteria, it's classified as such. Now, when we talk about BMI, which you brought up, is very important. If you go to my website, which is www.Memphis Weight Loss Surgery, it's all one word, 3 S's in a row. It looks funny. MemphisWeightLossSurgery.com. On that website, all the things I'm going to talk about tonight are on there. But one of the most important things is there's a BMI calculator. BMI is a body mass index. This is how we talk about persons, body mass, whether they're overweight, whether they're obese, morbidly obese, etc. The BMI is a calculation of your height and your weight. It's a kind of a mathematical formula. You can also go to your computer, go to any website, type in BMI calculator, or your iPhone or your Droid all have these apps for just BMI calculator. If your BMI is 35 or greater, you are probably in the surgical category, meaning that all the diets and all the exercise that you can possibly think of doing are probably not going to help you lose the 100+ pounds that you need to lose. all studies pretty much point to the fact that once your BMI is 35 or greater, to really make a significant change, surgery is the number one, if not the only treatment that should be prescribed to the patient. Not to say that you still don't have to modify your lifestyle and modify your portion control, what you're eating, and some exercise, but surgery is the mainstay of the treatment once your BMI is 35.
Okay, so Dr. Wegner, since you mentioned that, why is it that diets don't work? You know, you have people that yo-yo, they lose weight and then they're happy and you see them again. They always say, well, I lost this weight, but I've gained 20 back. What's the problem there?
So I do these informational seminars at the hospital every couple of weeks, 100 patients, 100 potential patients, 150 patients. You came to one.
Yes.
You got to experience it. It's a fantastic forum to get a lot of these questions answered. They talk about them on my website at St. Francis Hospital. But essentially, almost every patient that I operate on or treat has been on a diet. And they ask that exact question. I've been on the Ornish diet, the Atkins diet, the Zone diet, the South Beach diet, the Grapefruit diet. They've been on Weight Watchers. They've been on Jenny Craig. And we're talking about thousands of dollars and hundreds of hours spent dieting and on these food programs and all these reading these books and these manuals and all these crazy workouts. The problem is when you go on a diet and if your BMI is over 35, there's an inherent setup for you to fail. All of the studies show, like I said before, once your BMI is 35, you really need to change the actual metabolism of your body if you're really going to have significant weight loss. So when you go on a diet, what you're doing is you're essentially decreasing the amount of calories that you're taking in. So when you do that, your body doesn't like that. Now, you can do that for a while. You can do it for 6 months, 8 months, a year, maybe longer. But eventually, the hormones that control your metabolism, your satiety, your feeling of fullness, and your appetite, in particular, appetite hormone is ghrelin. A lot of people have heard of that. They'll Google it. They'll ask me about it. The satiety hormones are peptide YY and CCK. The metabolism hormones are leptin and melanocortin. All these hormones, when you go on a diet, work in the opposite that you want. You reduce your calories, what happens? Your appetite goes up.
Yes.
Right? But you want it to go down.
Right.
The feeling of fullness, your satiety, it goes down. But you want it to go up. You want to feel full, but you don't. Your metabolism that you're trying to rev up to burn calories, it slows down. So your body kind of goes into this, hibernation state. It starts saving the calories, thinking that it's starving. So all the hormones are fighting all the things you're trying to do. So eventually what happens? You come right back to where you were, the same weight you started the diet at, if not more. Some patients go on a diet, they lose 30, 40, 50 pounds. And before you know it, a year or two later, they're back up 60 pounds where they were before. So that's the cycle that surgery can break. The surgery that I perform actually changes your physiology. It changes your metabolism. It changes your nutrient utilization. It changes your energy balance. So, it's much more than just saying, hey, Mr. and Mrs. Smith, why don't you just eat less and exercise more? If you need to lose 100 pounds, there's so much more to it than that. We know that obesity is such a complex disease. To give a little background on it, there's essentially 6 components that work together to kind of make a person obese. One of the components is genetics. We can't change that. That is your genetic makeup. Another of the 2 components we have control over are your environment and your behaviors. Those things can be modified. There's clearly a psychiatric component. 2 components that I work on is the metabolism and physiology. And I can change the gut hormones, so to speak, through surgery. I can trick the body into doing the reverse of what I just talked about. When you eat a meal, I can make you feel fuller quicker. I can make your appetite kind of go down and increase your metabolism, which is what we're trying to do in the first place. So substantial weight loss can occur for someone with a BMI over 35 if they have the right surgery. Coming to that'll be, next week or next month when we get together again. Tonight, I just want to focus on, what obesity is and how, we talk about it.
So let's go into some of the risks. I would love to talk about some of those things because I know now we're living in a time where overweight and being obese to a lot of people is a trend. Can I ask you just a few of the vital organs and you explain to our viewers how this affects them?
Yeah, when you talk about the vital organs and the body systems, body fat is not just a tissue that does nothing.
Okay.
It is metabolically active and it secretes hormones. Unfortunately, they're all bad. There's nothing that having excess body fat does for you that's a benefit. So, it's become such an epidemic. And when we talk about the body systems here in a minute,
okay,
it's just when we look at society right now as a whole, this is the first time the data came out about last week. I got an alert on my phone about it. This is the first time in the history of our country where obese people, meaning people with a BMI over 30, now outnumber overweight people. There's 67 million obese people and 65 million overweight people. Now, overweight BMI is 25 to 30. Once you're 30, you're classified as obese. Now, there's 3 classifications of obesity itself. There's 30 to 35, which is class 1, 35 to 40, class 2, 40 and over, class 3. Surgical candidates are 2 and 3. But over a third of this country at this point has a BMI over 30. It's just amazing how in the last 20 years, we've gone from, obesity not really being a problem, and now it is the major contributor probably to preventable, health diseases and health risks. And even in the childhood, age category, we've got, kids that are 18 years old on, injectable insulin and high blood pressure medication, which comes to the body systems. What does body fat affect? It affects everything. It affects every organ system, every body system in your body. Just going down the list, it can cause depression. It can cause strokes. It can cause, in your chest, you've got sleep apnea. Your pulmonary function tests are abnormal. Causes, increased blood pressure, hypertension, atherosclerosis, heart failure. Going into the abdomen, you can get all forms of cancer in your liver, in your esophagus, your pancreas, your kidneys, your colon. It causes acid reflux, very common. Moving down, it causes degenerative joint disease, arthritis. It causes, people to have their knees and their hips fail. They need joint replacement. Causes gout, causes skin manifestations, venous stasis disease. The list goes on and on. Gallstones, pancreatitis. In 2007, there were 84,000 cases of new cancer diagnosed. Of the 84,000, 4% in women and 7% in men, the only cause of the cancer was obesity. This is not a vanity operation.
Right.
This is a health operation.
Yes.
This isn't about just, hey, I want to look better in a dress, or I want to, have a better, visual appearance. This is a surgery that saves your life. It cures medical problems and comorbidities, which a lot of people, think that, it's a cosmetic thing. It's not cosmetic surgery. This is something that, and you saw that.
In the 2 minutes that we have left, I would like for you to tell our viewers again, next medical talk show we're going to be talking about.
All right, Betty's giving me the hook. So in 2 minutes, next segment, we're going to talk about surgery.
Yes.
The difference between gastric sleeve and gastric bypass. I'll talk about, the risks and the benefits, how they're performed, how many nights you have to stay in the hospital, the vitamins, the pre-op diet, all that kind of stuff. And
you've heard it from one of the masters, Dr. Robert Wegner, and he will be here with me for the next medical class. So get all your questions together. If you think tonight was amazing, you just wait until he get down into the surgery. Again, I'm Betty LaMarr. Very special guest this evening, Dr. Robert Wegner.
Thanks for listening to Eye on Memphis with Betty LaMarr, coming to you live from the Bluff City. For more great shows, subscribe to our YouTube channel, Betty LaMarr Memphis. Visit our website, www.thebettylamarrshow.com. Email Betty@thebettylamarrshow.com.